February 19th, 2001 is the day that our Abigail passed away. About 7 o'clock in the evening, we were reading books, and Abigail said she didn't feel well.
The early signs of invasive pneumococcal disease might not stand out in a person's mind. It's that it progresses so rapidly. That's one of the problems.
By about 6 o'clock in the morning, Dwayne said, "Shannon, we need to take her to the emergency room. She's very sick."
The bacteria affects different parts of the body. It can affect the bloodstream, the ears, the brain, the lungs.
She was starting to develop purple blotches all over her extremities.
Invasive pneumococcal disease causes acute illness, like meningitis and pneumonia, but it can also lead to long-term problems, like brain damage and deafness.
We went into the emergency room and they started calling code red. So they knew that she was dying. Our daughter was 2 weeks shy of her 6th birthday.
Invasive pneumococcal disease causes tens of thousands of hospitalizations and many deaths each year in the United States.
Our little boy, who was 11 months younger, saw the whole thing. We were able to rock Abigail afterwards for hours, and then they performed an autopsy on Abigail. She had overwhelming sepsis due to pneumococcal.
Sepsis is another way of saying that the bacteria is entering the bloodstream, and that'll lead to having the body shut down.
We went home, and Samuel started to vomit. And I couldn't believe that I was going through this. They admitted Samuel, and he was in the hospital for 2 days. And then after he got out, we were able to have a funeral for our daughter.
In order to prevent pneumococcal disease, it's really important to be vaccinated.
We had a doctor that was a younger doctor.
Hi, Dada.
Hi.
Who didn't have a strong belief in vaccinations and had actually encouraged us not to vaccinate.
It's better to prevent the disease by getting the vaccine than by trying to fight it with antibiotics that may or may not work.
They were not vaccinated, and because of Samuel's asthma, they should have been vaccinated.
This is a disease where we have 2 vaccines, one for the young children and one for seniors. Interestingly, by vaccinating young children, we've seen a decline in the rate of death from invasive pneumococcal disease in the elderly.
He now has a younger brother, so his role in the family has changed from youngest child now to oldest child. He talks about his sister and wants to make sure that Nicholas, our 5-year-old, knows about his sister.
If you've already had pneumococcal disease, you still need the vaccine because there are so many different types of pneumococcal disease.
I can't tell parents enough the importance of vaccinations.
Check with your provider to see if immunization is right for your family.
I hope that no one else has to hold their child while they